70% of women gain weight during the menopause transition, and most of them have been told it's totally within their control, but it isn't, and there's a reason. I'm Dr. Kelly Brown, a board-certified family medicine physician who built a concierge practice because 15 minutes was never going to be enough time to actually help women through this part of life. I'm going to tell you what is actually happening in your body, what Wegovy and Zepbound do mechanically, the head-to-head trial data on which one works better, a finding about hormone therapy that most physicians haven't caught up on yet, and a medication that's coming next that's going to change the ceiling of what's possible in this class. Stay with me. The last third of this video has information that's going to change how you think about this entire category. Quick clarifier first, because even a lot of doctors confuse this. Ozempic and Mounjaro are not weight loss medications. They are FDA approved for type 2 diabetes. The weight loss was just a side effect. Wegovy is semaglutide, same active ingredient as Ozempic, approved for weight management. Zepbound is tirzepatide, same active ingredient as Mounjaro, but approved for weight management and obstructive sleep apnea with obesity. Same drugs, different FDA approved uses. And this distinction matters more than you'd think. I'll come back to why in a minute. From here on out, I'll use Wegovy and Zepbound because that's what we're actually talking about. Here is what nobody explained to you. Estrogen does far more than regulate your menstrual cycle. It directly influences how hungry you feel, how your body stores fat, and how sensitive your cells are to insulin. When estrogen begins declining in perimenopause, three things shift simultaneously. Insulin resistance increases, even if your diet hasn't changed. Fat stops going to your hips and thighs and starts accumulating around your midsection. That's visceral fat, wraps around your organs and increases your inflammation. Your satiety signals weaken, so you feel less full even after eating. Here's the simplest way to understand what's happening. Your GLP-1 system is like a thermostat for hunger. Estrogen is the battery that makes the thermostat work. When estrogen runs low, the thermostat becomes less accurate. It reads hungry when you should feel full. It reads craving when your body doesn't actually need food. The wiring is not broken, but the power source is depleted. That's exactly why these medications work the way they do. They really restore power or signal to the thermostat. Wegovy is a GLP-1 receptor agonist, one receptor. It mimics the gut hormone that signals fullness, slows stomach emptying, and improves insulin sensitivity. In the Step 1 trial published in the New England Journal of Medicine, Wegovy produced an average of about 15% body weight loss over 68 weeks. Over 90% of patients achieved at least 5% of their body weight loss, and that's real clinically significant weight loss. Hold that 15% number, because in a minute, I'm going to talk you through a head-to-head trial where this medication actually came in second, and the gap was bigger than anyone expected. Zepbound is a different drug. Mechanically, semaglutide activates one receptor, tirzepatide activates two, GLP-1 and GIP. GIP is a second gut hormone involved in insulin release, fat storage, and energy balance. In May 2025, the New England Journal of Medicine published the SURMOUNT-5 trial, the first direct head-to-head randomized control trial ever conducted between these two medications. 751 adults with obesity, 72 weeks. Zepbound produced 20.2% average body weight loss. Wegovy produced 13.7%. That's a 47% greater relative weight loss. Waist circumference on Zepbound dropped 18.4 centimeters versus 13 centimeters on Wegovy. And here's the part specifically relevant to this audience. Women lost approximately 6% more weight than men in both treatment groups. The biology that makes women more vulnerable metabolically in perimenopause also appears to make them much more responsive to these medications. GI discontinuation, so that's folks who stop medication because of nausea or GI distress. It was 2.7% on Zepbound versus 5.6% on Wegovy. That's roughly half. If the question is which single medication has the stronger head-to-head data, the answer right now is obviously Zepbound. A quick note about the full weight loss dosing. It's not always the right answer for some of my patients, especially those whose real issue is insulin resistance, more than weight loss. A lower and more individualized approach is what actually matches the clinical picture. That's a different conversation, and I'm going to give it its own video, so subscribe if you want to catch that one. So this is where the research is getting really interesting. In April of 2024, a Mayo Clinic study was published in Menopause, the official journal of the North American Menopause Society, and they compared postmenopausal women on semaglutide alone to women on semaglutide plus hormone therapy. The women on both therapies lost substantially more weight at every single checkpoint, 3 months, 6, 9, 12. Then, in January of 2026, a larger Lancet study found a similar pattern with tirzepatide. Women on tirzepatide plus hormone therapy lost approximately 35% more weight than women on tirzepatide alone. So this is 2 separate studies, 2 different medications, but the same direction. And the biological mechanism makes sense. Estrogen directly enhances how your GLP-1 receptors respond to these drugs. When you replace the estrogen your body has lost, the medication actually works better. This matters for 2 reasons. If you're already on hormone therapy and considering a GLP-1, the medication may actually work better than you expect. And if you're on a GLP-1 alone and the results are underwhelming, the missing piece may not be a higher dose, and maybe the hormonal environment that your body is in needs to be adjusted. If this is the first time you're hearing this, drop a comment below. I'm actually kind of curious how many of you have been told nothing about this by your own doctor. These studies are still early. The Mayo cohort had 106 women. Larger trials are still needed, but the biology is coherent and the signal's consistent across 2 medications. This is an area where women should be having a real conversation with a physician who understands both sides. Now I want to tell you what is coming next, because this is where the numbers start to look genuinely different. Retatrutide, it's a triple agonist. It activates 3 receptors, GLP-1, GIP, and the glucagon receptor. That third one, glucagon, is an interesting one. It increases energy expenditure. You're not only suppressing appetite, you're actually changing or burning more calories at rest. In a phase 2 randomized controlled trial published in the New England Journal of Medicine in August of 2023, retatrutide at the 12 milligram dose produced an average weight loss of about 24.2% body weight in 48 weeks. Let me put this into context. Wegovy at 68 weeks, 15%. Zepbound head-to-head at 72 weeks, 20.2%. Retatrutide at just 48 weeks, 24.2%. 100% of participants on the highest dose lost at least 5% of body weight loss, that meaningful amount. 75% of the 12 milligram group lost at least 15% body weight loss. 72% of participants with prediabetes at baseline reverted to completely normal blood sugar levels. And LDL cholesterol, you know, the bad one, dropped roughly 20%. Liver fat reduced by up to 82% in a separate sub-study. The trajectory matters. 15%, 20%, 24%, the ceiling of what these medications can do is moving upward fast. There is one part of this conversation that is not getting enough attention. And for women in perimenopause, it's the most important part. In body composition studies, about 83 to 85% of the weight lost on these medications is fat. That's excellent. But 15 to 17% is lean mass, meaning your muscle. In a young, healthy person eating plenty of protein and lifting regularly, that's totally manageable. In a woman in perimenopause, it is not a small thing. Because estrogen protects your muscle, as estrogen declines, you're already losing some of that protection automatically. Now you add in a medication that dramatically suppresses your appetite, making it easy to eat significantly less protein without noticing. And then subtract the resistance training that most of us aren't doing consistently, you can end up losing a lot more muscle than you should, which is the opposite of what we want. Losing muscle slows metabolism, it reduces long-term strength, it accelerates the exact metabolic decline that these medications are supposed to address. This is not a reason to avoid the medication. It's a reason to use them intelligently and with oversight and with a plan. The research supports 1.5 to 1.8 grams of protein per kilo of your body weight per day. Spread that across all your meals, don't load it into one. And resistance training 2 to 3 times per week. And those two interventions significantly reduce the lean muscle mass loss during GLP-1 therapy. This is exactly why I'm cautious about these medications and the trend of getting these medicines without an ongoing clinical support plan. The prescription is not the whole plan. The plan is the plan. Wegovy works well. Zepbound works better. The head-to-head data is clear. If you're on hormone therapy or considering it, combining it with a GLP-1 may meaningfully improve your results. Retatrutide is the best by far. It's not even a question. Whichever tool is right for you, protect your muscle, get your protein, do your resistance training, and work with a physician who actually cares about you and will follow you in your journey. You are not failing. You're not imagining it. And you have more options than you've been told. If you're in Arizona and you want a physician who will actually sit with you and create a plan that includes all of these things, hormones, metabolism, your muscle, your long-term health and longevity, that's exactly what I built Ember to do. Links in the description. Discovery calls are just a conversation. And if this was useful, subscribe. I'll see you in the next one.